everyone, welcome back to this YouTube channel. My name is Oreoluwaa with a double A, and you're welcome to this YouTube space where I film about faith, health and lifestyle. Today's video is going to be another health-based video, and today we're talking about breast cancer. October has been popularly known as Breast Cancer Awareness Month. So, you know the drill, you expect a video from me already. But before we dive into what breast cancer is exactly, let me just share a few facts, okay? So, breast cancer is the second most common cancer after skin cancer. And amongst the list of all the cancers in the world, breast cancer is the second leading cause of death amongst all the cancers. So you can already tell that this is pretty important and it deserves a whole month of awareness. Alright, so what is breast cancer? If you watched my video on cervical cancer, I'll put up a link here. You can already understand the meaning of what I mean by cancer. Cancer is the abnormal replication of abnormal cells. So these abnormal cells grow faster and they replicate faster. That's what we call cancer. But now it's in a different side and it's of the breast tissue. Okay, so breast cancer is the abnormal growth of abnormal cells of the breast. Okay, so and we know that a lot of people will say it's only women that have breasts, it's only women that can have breast cancer. No, let me correct that. A lot of men, not as much as women though, but a lot of men also have breast cancer and they suffer from this condition. So don't just restrict this video to your female friends, share it to everyone because it is very, very important. So let's talk about the symptoms of breast cancer. What are the symptoms that people experience? The first thing you should know is that sometimes there are no symptoms, okay, but the things that you can easily see and that should set your alarm bells rolling quick, they include things like change in the size and the shape of the breast. So for every lady or for every person, you already know how your breast looks like, and then luckily for us we have two of them, so it is easy to compare both, right? So you can tell if there's a change in the size and the shape. We can see enlarged, if one of the breasts is undergoing or experiencing breast cancer changes, you can see or feel that the breast is bigger and it could be engorged, it could be harder than normal. All these type of changes that are not premenstrual, yes, all these type of changes that are not premenstrual should be checked, okay? Also, another important thing is any nipple discharge. If you find any nipple discharge from any of both breasts, that is not normal breast milk. Okay, so you're not breastfeeding and there's no reason for you to be lactating, but there's discharge from your breast, see your doctor. So I'm not saying that every time that someone has a nipple discharge it's breast cancer, but it's something to be checked, it's something to talk to your doctor about, because you might just be saving yourself from something dangerous. So any nipple discharge, including blood, there could be bloody discharge from the nipple as well. Change in the size and the shape of the nipple is something to be concerned about. So please talk to your doctor about that. Another thing that is also important is the development of any new lump in both breasts. However, not every lump is cancerous. Yes, not every lump is cancerous. If you do the regular breast self-examination, which I'll talk about later, you would understand that if you are checking your breast regularly, you know if there is a new lump, if there is anything that is just absurd, okay? So if there is a development of any lump in the breast, you should talk to your doctor about it. But like I said, don't take all these symptoms in isolation. Don't think you have a lump and then already feel like it's breast cancer. So there are a whole lot of factors that need to be put together in gathering the exact cause of the lump. There are some lumps that are not cancerous, like I said earlier, and it could just easily be taken out and that is the end. Meanwhile, there are some lumps that could be cancerous, depending on a lot of factors. Okay, so now let's talk about the risk factors for breast cancer. What are the factors that contribute to people having breast cancer? Okay, so the first thing I'm going to do is to split them into two parts. Okay, so there is non-modifiable risk factors and modifiable risk factors. It's not big grammar, just let me explain. Okay, so what I mean by non-modifiable are factors that you cannot change, factors that you cannot, like there's nothing you can do about it. Okay, and modifiable risk factors are things that you can, like you have an influence over, you can change, you have like an input, you can change things, you can affect the non-modifiable risk factors. Okay, but the non-modifiable risk factors, you can't do anything about it. So let me give you the non-modifiable risk factors. Example, being a woman. Just being a woman puts you at a higher risk for having breast cancer. Just like the men, when you're talking of prostate cancer, obviously as ladies we don't have prostate, so why are we having prostate cancer? So being a woman is like there's literally nothing you can do about it. We are more at risk of having breast cancer. Okay, so another non-modifiable risk factor that you should be aware of is family history. Now, if you notice, there are some people that have some family history of breast cancer. Maybe their mother or grandmother or aunties, sisters, people in your nuclear family or even extended family that have breast cancer. That is a risk factor for developing breast cancer because there is something that runs in the blood, and there is this particular gene we call BRCA1 and BRCA2 gene. So these genes are hereditary basically, and once it's in the blood, once someone has that gene, you're at a higher risk of having breast cancer. Another non-modifiable risk factor is age. So as you age, the more you advance in age, the more you're susceptible to having breast cancer. So younger women are less at risk and elderly women are more at risk of having cancer. And you can't slow down your age. I mean, every second it keeps counting and all of that. So once you start aging, you are at a higher risk. So now let's talk about the factors that you can change. Talking about the modifiable risk factors, which are factors that you have a possibility to change and influence. The first thing I'll talk about is obesity. Okay, so obesity increases the risk for cancer, and what you can do about that is keeping a healthy weight basically. Avoiding a sedentary lifestyle even as you age, exercise as much as you can. These are things that you can do to avoid obesity, because obesity is a factor in cancer generally. Modifiable risk factors include alcohol and smoking, especially alcohol and smoking. You see, these two things, they carry some components that can cause genetic modification, that can alter the normal genes of people, and then they begin to develop cancers when there's no even family history and all of that. So taking a lot of alcohol and smoking excessively is bad for your health, even for people that don't have family history of breast cancer. So generally, limit alcohol and limit smoking. So something else that you should also watch out for and take very, very importantly are birth control pills and hormone replacement therapies. These two things are method of contraception whereby people use to prevent pregnancy. Okay, so if you have family history, especially if there's a family history of breast cancer, it is wise and it is safe to talk to your doctor about it, as taking in continuous hormonal therapy is not healthy for you on the long run. There are other ways to prevent pregnancies. It's just better to talk to your doctor and explain all of this to him or her before you are being placed on birth control pills or hormone replacement therapies. Okay, another thing that also helps and lowers your risk of getting breast cancer is breastfeeding. Breastfeeding, like we all know, is cheap, is affordable, like it's everywhere basically, especially if you just give birth. And most women lactate easily after giving birth, so it is safer for you to breastfeed, as it not only helps your baby, it also helps you to prevent these things. So now I've dealt with all the risk factors. What are the measures that we can take as individuals to curb breast cancer? And note, these things that I'm about to mention, they do not in itself prevent breast cancer. No, they don't prevent breast cancer. They only help you diagnose or detect any changes, or if there's going to be breast cancer early. And if you diagnose it early, it means that you are able to combat these things early. Most times, if there is an early diagnosis for breast cancer, they usually get treated and everybody's fine. You go home, you go back to your normal life, all right? But early detection is key. So what are the things you can do at home? So the first thing I'm going to tell you about is the breast self-examination. As the name implies, it is a self-examination. It is something you're supposed to do by yourself at home, and at least once every month. Okay, it is pretty easy, doesn't require any serious technique or any instrument. You can do it from the comfort of your home, and I'm going to show you a video that will explain how this is done.
You can keep a lookout for breast abnormalities, starting with a visual examination of your breast with your arms by your side in a neutral position in front of a mirror. Look for any of the following: changes in the shape and size of one breast, dimpling or puckering of the breast skin or nipple, persistent rash or change in the skin around the nipple, nipple inversion, retraction, bleeding or unusual discharge, skin redness or soreness of the breast, accentuated veins of the surface of the breast, unusual swelling of one upper arm. Adopt the following two positions. Raise your arms above or behind your head. Press your hands on your hips and tense your chest muscles. These two positions allow for a closer inspection of the following: changes in the shape and size of one breast, dimpling or puckering of the breast skin or nipple. To feel for changes in your breast, underarm, and collarbone areas more accurately, do so by lying down, because the breast tissue spreads out evenly across your body. This makes it easier to feel for lumps. What you should look out for: a lump, swelling, or thickening in the breast or underarm area, any enlarged lymph nodes at the underarm and above the collarbones. Lying down. How to examine your breasts when lying down. Elevate your right shoulder by placing a folded towel or pillow underneath. Extend your right elbow outwards and place your right hand under your head. Use the pads of your 3 middle fingers and apply pressure to feel your breast tissue in a circular motion. Use 3 varying pressure levels, light, medium, and firm, to feel for all the breast tissue from the skin level to tissues closest to the muscles and ribs before moving on to the next area. Examine the whole breast systematically in a clockwise or anti-clockwise direction. Press down over your nipple with 3 varying pressure levels in a circular motion. To check for lumps at your underarm area, put your arms by your side. Start in the hollow of your underarm and move towards your breast, making overlapping small circular motion. To check above the collarbone, use light pressure and move in a circular motion. Repeat the same steps on your left side.
You should also check your underarm, as lumps and changes may also grow there, because the breast tissue extends to this aspect of your body as well. All right, so the second thing I'm going to talk about, which is a lot more complex, is the mammogram. This mammogram cannot be done in your home, but it's something that can be done in hospitals or tertiary facilities where they have these instruments and they have the facility to run this test. So for people that are above the age of 50, generally there are a lot of bodies that come up with routine screening methods for people, but generally I would just say that once you are above the age of 50, you should do it once every 2 years, pardon me, especially if there is no family history of breast cancer. But if there is a family history of breast cancer, it is better and safer to do this once every year, or rather still talk to your doctor about your choices, okay? But once you are above the age of 50, endeavor to do this once every 2 years if you are not if you don't have all of these risk factors that I mentioned earlier. I hope this video was really helpful for you. If you have any questions, do well to drop them in the comment section. Share this video with your friends, your family, your loved ones, everyone that is important to you, and I will definitely answer all the questions in the comment section. If the questions are long, we have this whole month for breast cancer awareness. I could film another video to answer all of your questions. All right, I will see you in my next video. Bye guys.